Hello and welcome back to the Simple English Learning Podcast, your friendly guide to real-world English. I'm Anne.
And I'm David. Picture this. You're having a great day, maybe playing a sport or just walking down the street, and suddenly, ouch, you injure yourself. It's not just the pain that's a problem, but now you have to go to a doctor and explain exactly what happened and how it feels, all in English. Describing an accident and the specific type of pain can be really tricky. You might worry that the doctor won't understand the seriousness of your injury.
Well, that's a fear we want to eliminate today. We're going to walk you through a complete doctor's visit for a common injury. You'll learn the vocabulary to describe how you got hurt, the words for different types of pain, and how to understand the doctor's treatment plan. Let's make medical English clear and simple together.
The conversation. Characters. David, the patient, who has injured his ankle. Anne, a supportive friend helping David. Dr. Chen, a clear, reassuring doctor. Scene. David is sitting on an examination table in a doctor's office, his foot propped up. Anne sits in the chair nearby. Dr. Chen enters, reading a chart.
Good afternoon, David. I'm Dr. Chen. The nurse tells me you've had an issue with your ankle. What happened?
Hi, doctor. Yes, I was jogging in the park yesterday evening. I wasn't paying attention for a second, and I stepped off the curb the wrong way.
I see. And what happened then?
I twisted my ankle. I felt a sharp pain immediately, and I fell over.
And you've had pain since then?
Yes, a lot of pain. I could barely walk home. My friend Anne had to help me.
Okay. Can you describe the pain for me now? Is it constant?
It's a constant, dull ache when I'm resting, but if I try to put any weight on it, it's a very sharp, shooting pain.
A sharp shooting pain. I understand. Where exactly does it hurt? Can you point to the spot?
It hurts most right here on the outside of my ankle.
All right. Have you noticed any other symptoms besides the pain?
Yes, it's very swollen. As you can see, it's much bigger than my other ankle. And a bruise started to appear this morning.
The swelling and bruising are very common with this type of injury. Have you put any ice on it?
I did last night for about 15 minutes before I went to bed.
That was a very good first step. I'm going to gently examine it now. Please tell me if the pain gets worse.
Ouch. Right there. That's very tender.
Okay. Now, can you try to move your foot up and down for me?
I can a little, but the movement is very limited. It feels stiff.
What about side to side?
No, that's too painful.
Understood. Based on your description of the accident and the examination, it seems you have a moderate ankle sprain.
Is a sprain a serious injury?
It can be, but in David's case, I don't believe there are any broken bones. A sprain means you've stretched or torn the ligaments in your ankle. It's painful, but it will heal with proper care.
That's good to hear. What do I need to do?
The best treatment plan is something we call R.I.C.E. It's an acronym.
R.I.C.E?
Yes, R is for rest. You must rest your ankle. No jogging, no long walks. Try to stay off it as much as possible for the next few days.
Okay, no exercise. I can do that.
I is for ice. You should apply an ice pack to the swollen area for 15 to 20 minutes several times a day. This will help reduce the swelling and pain.
We can get an ice pack at the pharmacy.
Exactly. C is for compression. I'm going to give you an elastic compression bandage. You should wrap your ankle to help control the swelling. It should be snug, but not too tight.
Okay, wrap the ankle.
And finally, E is for elevation. Whenever you are sitting or lying down, you should elevate your foot. Prop it up on some pillows so that it's higher than your heart.
Rest, ice, compression, elevation. Okay, I can remember that. What about the pain?
You can take an over-the-counter pain reliever like ibuprofen. It will help with both the pain and the inflammation.
So I don't need a prescription?
Not for the ibuprofen. Just follow the directions on the bottle. If the pain is still severe after a few days, call me. I expect you to feel a significant improvement in about a week.
And when can he start walking on it normally again?
He can start putting gentle weight on it in a few days, as the pain allows. He should listen to his body. It will likely take a few weeks to feel 100% back to normal.
Thank you so much, doctor. You've explained everything very clearly.
You're very welcome. If the swelling gets worse or the pain becomes unbearable, please come back immediately. Otherwise, just follow the R.I.C.E protocol.
I will. Thank you again.